Well, good afternoon. It's great to be in Sarasota, and I appreciate our guests for taking the time to be here to discuss some really important issues. I mean, obviously, during the coronavirus pandemic, we have focused a lot on what is happening directly with the virus in terms of infections and hospitalizations and on down the line. And that's obviously understandable. It's important. I will say that if you look in the Sarasota Manatee area, I think you've seen some really strong trends in a good direction over the last many weeks. Here in Sarasota, the last 2 weeks, we've seen test positivity usually in the 5 to 7% range. Visits to the emergency department for COVID-like illness in Sarasota County are down 70% since the week of July 12th. Hospitalized COVID positive patients are down 50% since July 23rd. And of course, in Sarasota, we've had a majority of the fatalities related to COVID have been residents of long-term care facilities, but we are seeing fewer COVID positive patients in long-term care facilities in Sarasota today than we have over the past many weeks. So we hope that that trend continues. In Manatee County, over the last 10 days, we've seen the test positivity range between 4.8 and 6.3%. Emergency department visits for COVID-like illness are down 50% since the week of June 28th. Hospitalized COVID positive patients are down 45% from the July 24th peak, and we hope that those trends will continue. So we're going to continue to focus resources, attention on directly dealing with the virus itself. But I think we also I think most people understand, some intuitively, some from what they've seen in the news or from people that they know, that there are many more impacts that this pandemic has had on our society. Of course, we see with what's happened with folks in their jobs. Now, we think that the economy is doing better now than it was in April, and we want that to continue. But there were major dislocations. Of course, there were dislocations with the school year going to virtual, which impacted many kids' lives and many families' lives. And I think kind of the big enchilada in all of this is an important issue even before this. But I think now with this, I think we're going to be dealing with ramifications involving mental health for a long time. And so we need to be prepared to face this head on. I'm glad that the First Lady is here. This is something that she's been involved with long before anybody knew what COVID-19 was. But we're in a situation now where we know we're already seeing some of the mental health effects, and we also, I think, intuitively understand how that affects child welfare and operation of our child welfare system. I asked Secretary Popple to serve as the agency head for DCF. I wanted him to provide a fresh perspective and figure out how we could do better, because it's a very difficult area to get good results in. We did pass a really significant bill this legislative session that I signed, Senate Bill 1326. It is an accountability bill that incentivizes new and effective approaches to protecting our children while weeding out low-performing providers. And if they fall below expectations, these providers, they can get assistance in implementing corrective action, but they will be terminated if they don't show improvement. Secretary has also succeeded in maintaining and even increasing funding, even though we're in difficult circumstances, by identifying things that work and making good recommendations to me, which of course I carried. So in this year's budget, we increased mental health funding in our K through 12 public schools by $25 million for a total of $100 million, including $5.5 million for youth mental health awareness and assistance training of school personnel, and $4 million for mental health services via telehealth. And I think the telehealth is something that as the pandemic was launched and wore on, more and more people were going to telehealth. We took some executive actions to ease some regulations so that people would have greater access to it. And I think most people think that on balance it's been very successful. And I think it's really portends continued use of this and even expansion of this as we go into the future. The First Lady has had for over a year Hope for Healing initiative. She wants to make make sure that our resources are maximized, and she's doing a really good job. So I think that this is something that, and we have some great people here who my wife's going to introduce in a minute, but it's not an easy issue. It's never been an easy issue. It's an often neglected issue because it's an easy issue to neglect if you really think about it. But I think it's something that we've recognized from the start of the administration was important, and I think that we're only scratching the surface in terms of the fallout from dealing with the pandemic and how that's influenced people's lives. Because, there's people in Florida who don't know a single person, that's ever tested positive for this thing. But I guarantee you, those people that don't know anyone that has maybe been personally impacted by it has had impacts in their lives from all the other things that's happened as a result of these many months. And so, we got to be there to do the best we can. I think it's going to require collaborative approach between different community organizations, local institutions, obviously the state. We are always looking to maximize federal dollars for things, but this is going to be something that's with us for a long time. And so it's an honor for me to have a great First Lady who understood the importance of this from the moment we really took office, and throughout the whole pandemic, even as she's nursing a newborn baby back in late March and early April. This was a concern of hers from the beginning, because I think she understood that you don't have these major changes in society without that impacting people in a profound way. And so we find ourselves here committed to doing all we can to ameliorate any problems that have developed.
We left that newborn baby this morning who was up at 2 a.m., so there's that part of the story.
But she was smiling at 2 a.m.
But she smiled.
She'll stay up, but she is a very, very happy baby.
So it makes it okay. You can't get too upset when she's smiling at 2 and 4 and 6 and 7. Anyway, I want to say, first of all, thank you for some really, truly wonderful child welfare advocates who are joining us. You guys are the champions in your society, and you're the champions for the voiceless. There's a lot of kids who can't fight, and you're fighting for them. And so we greatly appreciate all of the hard work, time, energy, and resources. Doug Staley, 25 years, just recently, for your commitment to the kids. So thank you for being here. We really appreciate it. We talk about the pandemic, we talk about numbers, and those numbers are important because they guide and they help us make decisions based on the data and the evidence, and I think that that's really important. So when we talk about what we're seeing with the child welfare, with the child crisis calls and the hotline calls about child abuse, we see that there's a 40% decrease between 1 month this year, I think March, versus 1 month a year ago, March of 2019. 40% decrease. 44% decrease in child abuse investigations, 32% decrease in sexual abuse call allegations, 50% decrease in calls about physical abuse. But those numbers really don't tell the story, because numbers are numbers, and these are children. So I went on this morning and I left a 3-year-old, a 2-year-old, and a 4-month-old with that perspective in my mind, who we obviously love more than anything else. I went online and I say, okay, who are these victims? What are their stories? What are we seeing? And honest to God, I found stories, but there is no way I can articulate it in front of you. I just can't. Because what our children are enduring at homes where they're not getting the proper supervision, they don't have their advocates fighting for them, I cannot put into words as a mother of a 3-year-old, a 2-year-old, and a 4-month-old baby. When you see victims of abuse as young as 2, babies, you can't, it's too much. So we're here to fight. We're here to fight for them, and we're here because we're going to make a difference. And we've got some wonderful people who've been making a difference in this area for a long time. Mental health is a big deal, and it will continue to be a big deal. When we say a 40% decrease, I just want to give a number to that. 40% decrease, that's 20,000 less calls you're seeing into the child crisis hotline. What is 20,000 people? How many kids does that represent? If you put that into a 20,000 less individuals being reported to the child crisis hotline. That's 250 school buses packed full of kids, one right after the other. That's how many kids are not getting a chance to be able to tell their story. So we just have to understand what we're talking about when we look at these numbers. We know that they're suffering. Yesterday, we saw the CDC came out with their mental health survey that they did in June. And we've had this roundtable planned for a week, but that came out yesterday. The survey that they conducted, 31% are experiencing depression, 26% of the people who they surveyed are experiencing trauma or stress-related issues. They're 11% seriously considering suicide, but of that, the 18 to 24 demographic, 75% of the respondents say they have at least one mental health symptom, whether it's depression or anxiety. 25% have thought about committing suicide in the past 30 days. So there are big-time ramifications for what we're seeing as a result of this. And so my initiative, Hope for Healing, we started it. We're doing a lot. We're working with the Secretary of DCF, Secretary of ACA, Department of Education, Department of Health, really to think about not only how we can help children, but how we can help people across the state. And I think one of the most important things we can do in the infancy, and we're working on it, is how do we get people to know about what care is available, because we could have the best programs, but if nobody knows that they exist, then they won't utilize them. And sometimes we find when it pertains to mental health, if they just know that there's an outlet, that there's somebody that they can talk to, then that makes a world of difference. And so we just have to make sure that we need to let people know that there's help out there. And so in addition to thanking the child welfare advocates around the table, I also want to thank the teachers who are on the front lines, who are the children's advocates, because, you know, as Doug will tell you, and he has a pretty powerful story, the refuge for a lot of these kids are the schools, and those teachers are just something else, and we appreciate them. So for them to be able to notice this and to report it, they're saving lives, and you know, we see the ramifications and implications of trauma for kids and what they endure and the lifelong struggles they have to. So those teachers who are identifying that, we just say thank you for all of your hard work. So with that, we've got some great people who are here today. Secretary Popple, if you want to kick things off, I know this has been a passion of yours as well, and we're working every day to try to protect Florida's kids.
Well, Governor and First Lady, thank you for having me. Very powerful words. I want to start by the Governor highlighted a couple things. Fundamentally, we needed to change in the child welfare system, and the Accountability Act tackled a broad swath of issues. But I just want to point out that all the investments and changes that we made, we did that before COVID. And so from the mental health investments that you have made in the school system and a DCF, the child welfare system investments you've made is kind of coming to fruition now when we need it. And so I just wanted to thank you, Governor, for the leadership in that perspective. It's a very big deal. It's interesting, our community-based care system or child welfare system is based on a model that was born right here in Sarasota County 22 years ago. 22 years ago. You know, over time, things kind of changed, and we really kind of lost touch from a funding perspective. In particular, we started to value children differently in different parts of the state. You could be in one part of the state, and there's prevention resources available, and safety resources available, and case management resources available, and you go to another county and it's not. It didn't make any sense. And so one of the first things the governor approved is we need to start equalizing this funding and have some sort of basis for doing it. And so there was a significant investment made this year into the child welfare system, and it's going to benefit the folks here in Sarasota County. I know there's more work to be done, but from a community-based perspective, I just want you all to know that we recognize the need. And we also recognize that this system of care works in this community because of the people here at this table. So thank you very much for that. You're finding ways to get stuff done here locally, and not just reaching out to the state saying we need more. You guys have a lot of ingenuity, and we've copied it all over the state. I'm happy to be here also because we're shining a light on a couple of issues, and the reduced calls to the hotline is a very real thing. It happens every summer, by the way. Every summer when school lets out, our teachers, our school resource officers, and the folks that are on the front lines with our kids, they don't get to be around the children. And so every summer you're talking about a third of a drop to the calls to the hotline. It usually lasts for about 2.5 months, and then you go. We've been going for 5+ months. It is horrible to think about a child stuck in a situation like you were describing, First Lady, and having that go on for this long. And so I'm glad we're here to talk about that particular issue specifically. We're very concerned about it at the department. And then the secondary issue of what's the mental health of the children when they're going to come back to school. And so I'm very thankful that we made investments, but I got to tell you, the CDC study yesterday was a kick in the gut. When you start to think of a group of young folks, 18 to 24, 25% of them have thought about death by suicide in the last 30 days. That is unbelievable. And so to your point, Governor, I think we don't really know, what the situation is going to be when all the children get back into school. But I'm certainly glad that we've got the resources there, the teachers are there, and we're going to be able to start socializing again. It's something that we're very concerned about at the department. So thank you for the time. And First Lady, back to you.
And Doug Staley, so again, congratulations on 25 years of being a part of the child welfare system. You've done a lot to help a lot of kids, so thank you. And for many of you already know, he's the executive director of the Child Protection Service. That was August, at the beginning of the year, he hit 25 years. In his first years at CPC, Doug served as a case coordinator on the child protection team. And basically that was interviewing children and families who had been affected by abuse and providing testimonies in court. He has a master's degree in social work from the University of South Florida. He has an extensive career in helping kids and really is a great advocate. So thanks for being here.
My pleasure. I would just thank the Governor and First Lady for this opportunity just to be able to talk about this topic, because what's unique about this community that we collaborate, as Dennis said earlier, is we come together to make this a priority, to work together, to fight, to address the issues and concerns, because we know we have to. These children matter, and they need our help and support. And as Mr. Secretary, as you said, child abuse is not happening less. These numbers have plummeted. They've plummeted here in our area as well, but we know that child abuse is still happening. It's still happening behind those closed doors. They're just not in those venues that they typically would be to report those abuses. So that's something we definitely need to address, and look at the mental health issues that impact our kids and our families, not just the kids, but the families as well, and the teachers involved in these cases as well.
Terry Hansen, she's joining us. She's the president and CEO of the Barancik Foundation, which strives to make a difference in Sarasota and really beyond, and was established in 2014, and she was hired as the first employee and has been with them ever since 2015. And you have 25 years in different leadership positions. And prior to joining the foundation, you were the president and CEO of the Gulf Coast Community Foundation, and you saw over $200 million in grants and initiatives based all really with your work and especially helping kids. So thanks for being here.
Thank you, Governor and Mrs. DeSantis. The Barancik Foundation, we believe the earlier the investment, the greater the return. And if we as a state can invest in these children from before they were born and get them what they need and help them with trauma-informed care when they hit on some tough times, that downstream they will be better off and our society will be better off. It will cost us less if we can invest in them now. So the earlier the investment, the greater the return. Thank you.
The Secretary and I talked about that. Prevention service is part of the accountability component of,
Yes,
of the act, which is important. That's important. Brina Slater is here. She's the president and CEO of Safe Children Coalition. She has over 25 years of experience as a child advocate as well. She has been in her current role for more than 4 years, really having the responsibility over all child welfare services in Sarasota, Manatee, DeSoto counties, including protective services, foster care, and adoption. So thanks for being here and your perspective.
Absolutely, and thank you, Governor and First Lady. One of the important things that you keep hearing over and over is the number of abuse calls are down. If you look at the flip side of that, the number of children being removed are not down. So that means that the severity of the child abuse that's occurring now is much greater. The children that are coming into care have much more needs. They have more mental health needs. And now, their parents are isolated, families are isolated, and then the under-reporting of child abuse is now just causing more and more stress on families, children not being able to go to school. So in our circuit in Sarasota, Manatee, and DeSoto, we serve 1,600 children just in our three-county area. And we, over the last year, have removed 706 children, which is an astronomical amount of children for our small circuit. We're considered one of the more medium to small circuits. And then if you look at the mental health piece of that, our children in care, our number of Baker Acts has actually doubled in the last 4 months since children have been more isolated. So that just shows you the trigger and the stressors that are happening with our children within our system. And everyone around this table has been huge partners. They've supported our organization and our foster parents and our relatives so that we can give the support that they need. We're definitely excited to be here, and thank you very much.
Dennis and Grazie McGillicuddy. Dennis, we went through everything that you and Grazie have done to support the community. We'd be here a while. I know that you're very both passionate about supporting kids. CEO Dennis of the All-Star Children's Foundation. You can talk a little bit about that. And just needless to say, you serve and do a lot with your sole focus being to help kids.
Well, thank you, Casey. And I think I will say a few words about All-Star, but I do also want to recognize the willingness of you all to step forward to let people be aware of the crisis we have in mental health. We've had a crisis well before the pandemic. Now we have a whole new layer. And I think we've got a perfect storm happening right now with Brina talking about Baker Act being up. I mean, these kids' lives are going to be affected the rest of their lives. So bringing awareness to this is really critical. And so we appreciate your coming to Sarasota, but for the whole state and our children. Because Casey, you really touched me when you talked about there's more than numbers. I can tell you what drives Gracie and I is the human suffering, to think about each individual child that's been abused and then what happens to them later in life. So it's hard to deal with that, and yet All-Star represents one of the organizations that's focusing on science-based, evidence-based brain science, that we actually can deal with the crises that's happening today and the crisis the kids go to with that. And Terry mentioned trauma-informed care. By focusing our attention on early childhood trauma with evidence-based practices and focusing on how families have to be healed, there's an intergenerational cycle that's going on. So that child that's Baker Acted today may end up being in prison and then have children after they get out of prison, and then the cycle starts all over again. So we're here to break that cycle using science and evidence-based. So again, I'll let Gracie say more, but thank you for your attention to this issue, because it's under the radar for so many people, and yet it's a huge human crisis.
Yeah, thank you all so much for being here. And I'm always touched by the heart that both of you have for children. And just this morning, when you said your baby woke you up at 4 o'clock in the morning and you thought it was cute and what a great smile she had. Well, imagine you were suffering from this pandemic, from the stress of everything that's going on. When that child woke up at this morning, you would not be looking so fondly at it. And these are the children we need to protect. We need to deal with the fear that has been caused by this pandemic. It's a disease that we can treat, we can control. But I don't know what the ramifications are going to be to our population from the fear and the stress that this has caused on the brain, the trauma that this pandemic has caused. And that's where, and we were underreporting symptoms. I mean, the statistics are horrendous. And we have to not look at statistics like Casey said, but each individual child that's being impacted by the disease, by trauma that's being caused by the fear created from this disease. And that's going to have the child abuse, and I've been working on it for years and years and years and years. And it's existed for a long time. And according to Dr. Block, the greatest unaddressed public health threat we have, the child abuse, is the greatest, adverse childhood experiences are the greatest single unaddressed public health threat we have in this country today. And that's what we need to deal, and that was before the pandemic. Now this pandemic has just absolutely this has exponentially increased the trauma. And for adults, for parents, for teachers, for children, imagine your parent, you've always played and everything, and all of a sudden your mother is just taking that Clorox wipe and wiping this up and wiping this up and following you around and making you wash your hands and wearing a mask and going this. The stress is unbelievable, and that's in the best of circumstances. But then you take parents who've lost their jobs, who don't know, and the food, the children that are not going to school, there's that where they don't get fed. Most of these kids are getting fed in schools now, and then they take backpacks home to feed their families for the weekend. We need to, when we put our children back in school, we need to make it also not a traumatic experience. You know, I look at all of you there with our masks and everything. We've been trained. We were told we were 6 feet apart so we could take our masks off. But and the thing is, you've got your amygdala, which just slaps like this. When you talk about slipping your lid, then your cortisol keeps getting pumped in your body for that fight, flight, or freeze mode. So it impairs your immune system too. So we have to really deal at this whole crisis from a health perspective, and a physical health and a mental health perspective. So I just thank you from the bottom of my heart for caring so much about our kids, and I'm really touched because what's been going on with kids has been awful. And when you talk about it, it's easy to neglect. Well, child abuse has always been a secret. No one wants to talk about it. And now I'm just so pleased and grateful that we're talking about child abuse and let's really collaborate. Let's get together. Let's figure out how we can make this a safer world for our children, both from diseases, but most of all from mental health, because diseases last a week or 2 weeks, but this mental health it has a shadow of a lifetime, and that's what we really need to address. And I thank you so much for having me. I'm just too passionate, and I'll be quiet right now.
Well, thank you. Thank you all for coming and for all you're doing, because we know that it's a lot of work. We know that there's a lot of folks that need help. So thanks for doing it. Chad, can you talk about, you mentioned it a little bit, but about the role that kind of in-person school plays in ensuring child welfare, and obviously the calls went down when we went to distance learning, but if you could just kind of elaborate on that, I think people would appreciate it.
Thank you, Governor. So in state law, there's some requirements for mandatory reporters, and so our teachers are mandatory reporters. And actually, a lot of the work that goes on with children when we're investigating child abuse takes place at school. It's kind of a safe, neutral ground where you can talk to the child without all sorts of other variables being at play. And so between law enforcement and our teachers, that is overwhelmingly the number one source of all of the calls that come into the hotline. And so as I mentioned earlier, I guess it's kind of a seasonal sort of ebb and flow, but we all know that work in the system, when school lets out, the calls are going to go down. It's not a good thing. As it was said earlier, it doesn't mean the abuse isn't happening. It's still happening. But you have teachers that get to spend a significant amount of the time with the child. And so, First Lady, you mentioned just in that single month, physical abuse calls down 50%. That's your busted lips, your black eyes. But there's so much more that a teacher gets to, as they get to know that child and that child starts to open up to the teacher. That's where you start to find the comments that might lead to a call about sexual abuse or mental abuse. There's all sorts of things that are going on in these children's lives that really we trust our teachers to be kind of on the front lines to get that to the department so that all of these professionals can start to wrap around that child and that family. It's a very complicated, elaborate network and process, but it really all starts with a caring teacher that gets to know the child in their class and builds that relationship. So they're very critical to our entire system.
Doug, we were talking a little bit earlier, and you've been as an advocate for a long time. There's a story that has kind of stuck with you as someone who is older now, but reminisced about, unfortunately,
an
some
individual
things.
that has spoken on behalf of our agency, and he shares as a child that, home was not safe. It was not safe at all. It was scary. And school was his safe place. And he just loved to be in school for the social interaction, the connection. And it was absolutely not safe. And he made the comment that if he wasn't going to be in school, that would be awful for him. And it would almost be, he even said he would consider suicide as a result because things had been so bad in home, and school provided that safe environment. For him to be able to share that, the importance of being in school and the connectivity really strikes a chord with us of the importance for being in school and what it means to our kids and families.
Marina, we were talking a little bit as well about just some of the abandonment is really striking you, and those numbers being up. What does that mean when you say that there's abandonment?
So we've had 10% of our children that have been removed since COVID started, since the middle of March. 10% of our kids were for abandonment, which has never been an issue in our area. However, they are children that have committed crimes, and their parents or relatives or adoptive parents, whoever their guardian is, just doesn't feel comfortable with them back in the house. They could have, there could have been domestic violence with their parent. They could have stabbed their brother or their mom or dad, or an issue. However, with the court systems being closed, those children that would normally be served through the criminal system or have a trial have now come into the system of dependency care, which is difficult for our system because we really are for abused, neglected, and abandoned children. Although these children are considered abandoned because their parents can't take care of them, it's a struggle for us as a system because our case managers and our providers are not equipped to handle children with significant criminal histories or ankle monitors and different issues that a child that has been abused, it needs a different sort of care than a child that has been in the criminal system. So that's definitely been our significant struggle since the pandemic started, is some teenagers and some of the criminal histories, and even our own foster children that have gone on the run. While we've had better stable placements with a lot of our foster parents, and they've really enjoyed being able to do more telehealth and more virtual visits with their parents. It seems like they've been able to stabilize better, but it's been a struggle for our teens that are in foster care. They've been kind of shut down for the last several months, and they're getting antsy, and they want to, they'll go on the run, or they'll, we have children that are substance abuse users. So that's been our probably main struggle since. So we're definitely excited about school getting back in session here. Manatee starts Monday, and then Sarasota starts the following Monday. So we're excited about our caregivers and our foster parents having the choice to put their children back into school, and hopefully it'll stabilize some of the families.
First Lady, I would be remiss, and I'll let you do it, but if we should publicly thank our foster parents through this unbelievable what they've done throughout this entire pandemic.
Our foster parents have been absolutely amazing, and also actually several of the community foundations, the Forensic Foundation being one of them, actually got our foster parents gift cards for during the pandemic, because several of them lost their jobs. Several of them didn't have school where they could, send their foster kids to. They all became teachers like we all did as parents, and it was just amazing, the outpour of gratitude from our community that just helped all of our kids. All Star was doing therapy for our children for free. So we've had amazing community support for our community-based care area since COVID started. So.
I think it's important, Chad, too, since we're so blessed to have a lot of media here to talk about if somebody wants to learn to be a foster parent, if you want to help a child, what's the best way that they can do that?
Thank you for that, and I'm going to kick that back over to you so that we cannot get that message out enough.
You can go right to our website. It's sccfl.org. So it's Safe Children Coalition, so sccfl.org, and you can take foster parent classes online now.
And there's all kinds of ways you can help. It doesn't have to be just fostering. You could just give
Absolutely.
the foster parents a night out. I mean,
Yes.
there's all sorts of needs in
Yes.
our system.
We have volunteers that come and help foster parents. We have some that will come and just take care of the families, the kids, while they're having dinner time, or help them with school time or bedtime. And then our foster parents are amazing. They'll have the parents, now that we are all of a sudden all had to use teleconferencing, they'll let their parents read them a story to bed every night. They put them in bed through their iPhones. So there's been all kinds of amazing technology challenges we thought we'd have before, but it's really worked out great.
And Dennis and Grazie, I know you guys focus a lot on the impacts of childhood trauma, and that's obviously something that has been a fact of life in any respect. Then now we're in this, and it just seems to me that the possibilities of trauma during this period are probably as high as we've ever seen. So how are you guys seeing that? And in terms of what are you looking to be able to, your organization, to be able to help with, and then what are you going to have to do now that we may have a wider pool of folks?
So you're right that we don't have the numbers yet, but common sense tells you abuse is going on, and then you layer the stress that's coming out as a consequence of the COVID, is that both the intensity and the duration are going to be impacted to these children. As I said earlier, the shining light here is there is science to support the fact of what happens to a child because of trauma and how that affects them later in life, and that there are evidence-based protocols that can be used to actually heal, change the neural pathways of that child so they're not in fight or flight all the time, which represents the kind of behavior that comes out with these kids ending up in juvenile justice. So from our point of view, the focus is on enhancing the mental health services available that are trauma-informed based services to deal with that problem, and to enhance the other elements of people who serve these children. Foster parents, we are engaged in a very significant foster parent training over and above what Brina does to teach parents how to deal with a traumatized child, because their behavior is different than your normal child. And we've had amazing success. We've had disruptions that were going to happen, didn't happen, because we trained a foster parent how to deal with that behavior, and it was like an aha moment for this parent. So it's for us, having the opportunity that we have at All-Star to explore all the ways that we can change the lives of these abused children based on science and based on compassion. The notion of a child being loved and feel safe and get the treatments to help that child deal with what they've been through. You can't deny what they've been through, but there are ways where they can live with that and actually flourish. So, thank you.
Just you kind of mentioned it, but in terms of mitigating some of the trauma or avoiding it even happening in the first place, do you think having schools and activities and athletics available for the kids is important?
I think absolutely, because children are social beings, and human beings are social beings, and it's so important because even if the abuse is going on, they can report it to someone. Right now, children have no one to report the abuse to or tell them what's going on at home, because they can't go to the Boys and Girls Club, they can't go to Girls Incorporated, they can't go to their neighbors and play. You can't have birthday parties, you can't go to church. The children are absolutely isolated and locked down with the most horrendous cases of abuse. So I think it's really important that we deal, and that's with All-Star, when a child comes in from foster care, we deal with the child, we deal with the bio parent, and then everybody that comes in contact with that child. So when that child goes back, and this was before the pandemic, is then how do we make Sarasota a trauma-informed community? And I think by having that one child come in, we can do the ripple effect. But I think right now, we need a tsunami of care. So how we can teach and work with parents, children, teachers, caregivers, everybody, our justice system in dealing with the trauma that children are experiencing right now and their parents. It's really, really important.
Any final thoughts? Anybody?
Oh, I just want to say thank you again for all of your service, and we're going to be working on this very robustly. This is a priority of mine, and I know that the governor is very passionate about trying to help those in need and always supporting those who don't have a voice and making sure that their voices are heard and that they know that we are fighting for them, that we need to make sure we're taking them into account. And I'll tell you, as for perspective of the little baby, that's what gives you hope. When you wake up in the morning and you see a 2-year-old or a 3-year-old throwing Cheerios on the floor or smiling, and just they're so happy and they love life. We want every kid to love life and to be happy, and that gives us hope
Our
every day.
3-year-old isn't always that happy, so let's just be on the record.
That's a good point. Little trouble muffin.
Our youngest, Mamie, is very, very happy. I mean, just like you could walk in, you smile at her, she beams, she chirps. Our oldest, Madison, was, she's great, but she's also,
smart.
She's very smart. But even as a baby, I mean, she had little mood here or there sometimes. wasn't 100% peaches and cream. Great kid, but that was that. Then we were talking about our son Mason, and we were like, what was Mason like? And this was like, Mason was born March of 2018. So, I was in the Congress running for governor, all this stuff. It was like a blur, and we're just thinking like, it was kind of a blur with Mason. He's a great kid,
great.
and I think he was probably closer to Mamie in happiness than Madison a little bit. But we were just like, man. But it just shows you this stuff goes by very quickly, and so just the opportunity to be a parent is such a special thing, and we try to cherish it. Obviously, we had Mamie, as the pandemic was reaching a height in March. Or at least was in certain parts of the country, and it was kind of surreal, going through that. But it does remind you as to why this is important, because these kids really are why we're doing this. So I thank you guys for I thank you guys for what you're doing, because it's really important, and these are going to be perennial issues for us. They always were. We obviously want to shine more of a light and show some support as best we can. But now with what we've seen over the last many months, I mean, you can bet your bottom dollar that this is going to be something that's going to have a lot of implications. So we just need to let people know that and be prepared. And I think we're already seeing it, but I think we're going to continue to see it over these upcoming months. And with that, happy to take some questions.
Governor Zach Anderson with the Sarasota Herald Tribune and Gannett, Florida newspapers. You've been pushing for schools to reopen. We've seen schools reopen in other states and then shut down again in Georgia and elsewhere because of coronavirus outbreaks. Do you think schools should shut down if they have an outbreak? And if so, should every family be preparing for distance learning?
Well, we believe that parents deserve a choice, and if a parent believes that distance learning is the right thing, then we think the parent should be able to have that choice honored. These are unusual circumstances. I've said personally as a parent, I'm very, very comforted by the data that shows, our kids are very, very lower risk for this than they are for seasonal influenza. At the same time, I think parents need to be able to make that determination, but I also think it would be really bad policy to deny those many other parents the opportunity to resume in-person instruction for their kids. And so I think school districts, because we understand how important it is, and this is obviously just one aspect of it, social development, academic development, all these other things. And so, I think that the school districts, and I've been able to talk to a number of superintendents who have who have already started this week, and I think they're approaching it very smartly. If somebody is on a school bus and they're ill, then you send them home. And if parents have a child that's ill, you keep them home. The good thing about one good thing of having done all the distance learning, even though I don't think it was as good academically, is we are in a situation where, because when I was a kid, if you miss school, you miss school. I mean, that may set you back if you miss for a couple days. Well, now we have all this stuff. We were at a school up in Hillsborough County, public charter. and they have it being broadcast anyways. And so they're in person, they do all these precautions, but they're in person. Some parents have asked for the distance. And so if you are in person but you're sick, you stay home, guess what? You don't miss a beat. You're there. So I think that they're very smart about being very forward-leaning on having folks who are symptomatic staying at home. If someone develops symptoms, removing them from school. But I think doing a more surgical approach like that makes much more sense than just, if one person's sick, then you shut down the whole school. I don't think that's how a lot of these districts are going to approach it. I think it'll be on a case-by-case basis.
Governor Evan Donovan, WFLA 8 on your side. It's wonderful that you and the First Lady are bringing some attention to this issue, but why did it take the COVID pandemic to do it? Florida ranks last or next to last in mental health funding per person. There's no coordinating statewide agency. There's no mental health director for the state. When will your administration make specific investments like that into an issue that educators, parents, and especially law enforcement agencies have been complaining about for decades?
Well, you must not have been listening to what we said when we started. I mean, this has been one of the First Lady's major initiatives with her Hope for Healing. We did a far-reaching accountability measure to try to get actual results that was passed by the legislature. That was passed by them before the pandemic really started. We did the increased funding. If you look at the $100 million, we're now doing, for the mental health, $25 million increase. So this has been a priority, and I think that it should be a priority. The pandemic, I think, highlights the importance of it, and it also just, for all the issues that we had in terms of mental health and child welfare, this is only going to make it, that much more significant. But, the First Lady has been looking with Hope for Healing is, there's a lot of states that plow resources into things and get no results from it. And so what we're trying to do is have accountability, use the resources that we have, and there are more resources now, even in a tough budget year, but showing that is actually working. And if it's not working, holding people accountable. And that, I think, is something that has been missing. And I know Chad has been working hard. And Chad and Casey, you guys may want to say something about that too.
Well, at the department, we are considered the mental health expert for the state agencies, and I can tell you from very early on, the First Lady was convening all of the agencies that had any hand in mental health issues and driving coordinated strategies across that. We also fund community-based mental health models that were based in large part on the community-based child welfare models. So we have community networks set up as well. We're working with our MMA partners through ACA and the other state agencies. So there's a lot of activity that's going on, a lot of coordination. And I do want to echo what you're saying. This is not just something that's come along now. This was from day one. Very early on.
And I would say, too, that the sole focus of the cabinet, too, because I've been blessed to be the chair of the Children and Youth Cabinet, and from the very beginning, children have been the priority, obviously, but youth suicide, that was one of the priorities that we set out very early. We look at the data. We're looking across state lines at mentorship and things that we can do that are complements to early intervention and prevention, because at the end of the day, if we can reach a child early, we know that we can save the state a lot of money, but we can save more lives, and we can have children live more meaningful lives. I'll say this, too. One of the things that we noticed when we came in is there's a very siloed effect, siloed kind of a way of doing things amongst the child welfare and really a lot of different components of government. It is not just government. It is also looking at the faith-based community. It's also looking at the nonprofits. It's also looking at the private sector. It's looking at people like Dennis and Grazie McGillicuddy, who have donated a lot of money, time, energy, and resources. But if everybody is going in their own road, and government's here, and the nonprofits are here, and faith-based is here, and the private sector's here, we need to get together and work together for the same goal, and we need to communicate and collaborate. And so that's really what Hope for Healing was in the very beginning when we launched it early. It's how do we work together, and how do we get meaningful outcomes to make sure that we are good stewards to the taxpayer, that we can get a return on our investment, and that means making sure that kids live fruitful, productive, and happy lives. And so we're committed to that.
Governor DeSantis, Kimberly with Fox 13 News out of Tampa. I know last month you did have to make some difficult decisions with the budget, and some funding was cut for mental health services. Just talking to some of the organizations here locally, they're concerned about how they will continue to offer services if cuts continue to come. What do you have?
Well, I think, we had a lot of funding for mental health. We had a lot of onesie twosies in the budget where you'd put 50 grand here, 100 grand there, and that was not just limited. I mean, that was a whole across the board. This was a budget year that was going to be difficult. We are looking at the way forward. I had to take $1 billion off the top. We were looking at that time, between $5 and $7 billion shortfall. So that got us $1 billion. And then I have the ability to probably get $1 billion by having the agencies withhold some money, reducing some administrative. Good thing about this with the telework is I think people have shown some of the travel that's done, doesn't need to be done. So there's a whole bunch of ways that we'll be able to, I think, save money there. And then we're also looking at the way to apply the Federal CARES Act dollars to be able to deal with a lot of our budget expenses, because if you think about it, the expenses have to be COVID related, but like our prison system. I mean, we're testing everybody in there. We've had to deal with COVID. It's been like one of the main issue that the prisons have dealt with. So obviously you can use it to fund that. You can use it to fund other things. And so my hope is that, we're able to, to have that in a good place. Good news is it seems like the revenue forecasts are coming in better than what we had thought. And I think July was better than what they had initially forecast. Heck, even April, which was our worst month, wasn't as bad as immediately forecasted. May was a little bit better than forecasted. June. So I think one of the things we've tried to do here, as we battle the coronavirus, understanding that having a functioning society, economy, all things are important, and I think we've been able to keep that going to do even better going forward. But it is going to require some, there will be some potentially more tough decisions. I think we're going to be able to get through this budget year without doing a special session. Certainly we'll be able to get to the end of the calendar year without having to do any type of special session. But some of this will be dependent on the overall health of the national economy, our economy here in Florida. Our unemployment rate, if you compare to some of the other states that are 15, 16%, we were 10.7. And that's with a very sensitive labor force in terms of hospitality and some of the other travel that really took a hit in March and April. That is starting to do better. And so I hope we can continue to put people to work, because that will really help us maintain a stable fiscal outlook. We're looking at this phase 4 that they may be doing in Washington. And I don't know, obviously anytime you're dealing with Washington, it's always a messy thing. But I do think that there's a possibility that there is, some more done, maybe on the unemployment front, but certainly on the state revenue front. I think we'd be able to make it work. We'll make it work no matter what. But any additional money that comes down would obviously impact the decisions that we're having to make in the future. But there's a lot of stuff. I mean, I vetoed my own job growth grant fund, which is basically $25 million where I could just go and give for infrastructure, whatever. My decision. Very powerful tool for the governor, something I liked, but we all got to make sacrifices here. So I ended up, I think of the billion we vetoed, I think like 400 million to 500 million was actually in my own governor's recommended budgets. And that's just the way you got to do it. So, all right, one more. Yes, ma'am.
Hi, I'm Rebecca Gutierrez with SNN, the Suncoast News Network here in Sarasota. And the fear of getting sick is still very much alive, not only for parents, but also for teachers. And some teachers are choosing not to go back to school, or either retiring or just, quitting or taking a leave. So do you have any concern about teacher shortages this year? So,
well, what I've said is we should be flexible. Any employee, teacher, or really any industry that is more higher risk for this, you have to make accommodations for. That's been in our part of our our guidance from the beginning across all industries. Education, no different. And I also said, look, if there are some teachers that maybe don't fit in that category but just aren't comfortable, make an accommodation. Some parents are going to want distance. Maybe they do the distance teaching, and you have others who want to be. So I've urged flexibility on it, because I think that it's just, it's a difficult time. People do have concerns. I will say, though, from an evidence-based approach, if you look at parts of the world that have had schools functioning for a while, the school has not proven to be a higher risk environment than other industries that have been operating, the whole time. And so I think that with proper precautions, people doing the basic things with an eye towards mitigation, I have no doubt that they can create a safe environment. When we were at the charter school over in Hillsborough, they had, from the desks to everything they were doing, was all geared towards having the environment be safe. And I think that if you think about it, just the fact that people are concerned and thinking about it is going to reduce the amount of transmission. I mean, a lot of the transmission happens, when folks are kind of throwing caution to the wind. So I know people are in those schools are going to be very focused on safety. But I think if you look at the experience of where this has been done, it obviously can be done safely, and I think it will be done safely. But I do think having the maximum flexibility. Look, we're going to have certain number of parents choose distance, and so if you have a teacher that has misgivings, I've urged the districts, okay, let the teacher do the distance for those kids. And you have to juggle some things around. We have a lot of teachers who really, really want to get back in, and I spoke with the superintendent in Suwannee County, which is in North Florida. And he said, the parents were coming and bringing the teachers presents because they were just so thankful they were back. The teachers had a renewed sense of purpose just because I think you appreciate, what school offers when it's taken away from you. And they had a lot of folks who I think they felt that their kids had missed out. And then we've specifically noticed that with our special needs teachers because, you can make an argument for virtual. I mean, I don't think it's as good. In some respects, if I listen to a college lecture online versus being in an auditorium of 500 people, would there be much difference in that? Probably not. But when you start getting to things that require more hands-on instruction, particularly with our students with unique abilities, the distance learning just can't get it done. And so, we had teachers talking about, they were really, really pained with what happened in March, April, May. And they were saying we've got to get the kids back. So I think that there's a bunch of different perspectives on it. But the maximum flexibility is very important. A clear attention to safety is very important. But I do think, as I mentioned at the top, the indicators that we see in Sarasota and Manatee, are positive. I mean, the movement that we're seeing is what we're seeing really all over the state in many respects. But when you go to a 70% decline in ED visits for COVID-like illness, when you're looking at a 50% drop in COVID positive patients that are hospitalized. Now, granted, not all those are hospitalized for COVID because they test everybody, so some are hospitalized for other things. But when you see that over just a 3-week period, those are really, really significant trends. The positivity is lower pretty much everywhere around the state than it was a month ago. And I know there's problems with that metric because of some of the reporting issues we've seen, and I do take that into consideration. But I think even considering that, where we were at the beginning of July to where we are now. So I think that Floridians have done a great job. I think that's going in a good direction. I hope it continues to do that, and then I think that will make the school year get off to a good start. We've had the districts that have been open now for this week have had had success. They obviously are prepared. You have different things that happen and you deal with it. But I was talking to the superintendent in Martin County, and they had 62% of the parents opted for in-person, 38 virtual. But then after a few days, those virtual parents, you started to see movement saying, "Hey, we want to get the kids back in too." So I think that's what will happen. I think you're going to see a lot of parents who are just gung ho about school starting again. I think you're going to see some that just want to keep distance, but I think you're going to see some who are a little bit, want to wait and see. So maybe they'll do distance, but I think then we'll be able to, if they think that it's being done well, we'll want to go forward. So, but I really appreciate what all the folks have been doing around the state. It's not an easy thing when you're juggling all these things. I mean, it's one thing to say run a school district. That's not an easy thing at all to do that. But then it's one thing to say, okay, in the middle of the school year, you got to have to do distance learning and just get it done. That's a big change that they had to deal with. Now they're being told, okay, offer the parents the distance who want it, offer the parents in person who want it, and you're probably doing a hybrid for some parents that may want a little bit of both. That requires a lot of innovation and creativity, and I think you're seeing that around the state. But I just wanted to say that, as governor, I really appreciate it, because they're really having to go above and beyond to try to provide all these options for parents and ultimately opportunities for our kids. Thanks, everybody.